Hi everyone, and welcome to Nairita's Talk, dedicated platform to help you all find the right insight and the right information in the beauty and aesthetic world. Bringing education, sharing the latest technology, and introducing you to the best doctor. So today we're very fortunate to have Dr. Sergio Morral visiting us all the way from Barcelona to give his fruitful insight in this field. Hi, doctor.
Hi.
How are you?
Thank you to invite me to this interview.
Thank you for accepting our invitation.
I'm
So this is your first time in Dubai, right?
It's my first time and I hope so not the last one.
Yes. So tell me more about yourself. Who is Dr. Sergio Morral?
Well, I'm working in Barcelona from almost 20 years ago. And I'm the coordinator of plastic surgery department in my clinic. It's called Policlínica Barcelona. And since then, I'm working there and working and mixing sometimes. I'm working in a social health as well, doing reconstructive surgery, not just aesthetic surgery.
So I know you have a very stressful job, especially dealing with women. How do you distress yourself?
Well, I'm a musician as well. I play the piano, accordion, and I love to do sports. That's the two ways I'm trying to distress myself.
So when you were in a school, how good you were in science?
I was pretty good. Even when I was 12, 13 years old in the institute, I was starting to read books from medicine. Did
you ever wanted to be a doctor?
My mom told me, I don't remember, but when I was 4 years old, my mom always told me, they asked me, what do you want to be when you're becoming older? And I always say, a doctor.
Wow,
yes.
So since 4 years old.
In fact, I started to study anatomy, making dissections with cadavers at the university when I was just 15 years old. Yeah. I was so into to do something important in my life, to become a doctor, why not?
So you like the biology itself?
Love it.
Good. So doctor, tell me more about the latest trend for this year.
Well, I think the future in aesthetic and plastic surgery, it's about stem cells, really. It's actually it's a reality. We started to use that from a few years ago. But maybe to impress new organs, just using stem cells, maybe the future is it's about that, going in that way. But talking about aesthetic surgery, maybe laser are improving the technology. Laser, it's on fashion in Latin America and in Europe as well.
Can you tell us the difference after? I want to know the difference between the Vaser and the laser.
Vaser is ultrasonic liposuction, and laser is laser liposuction. One thing is to use ultrasons, makes the surgery easier and improves the tissue's quality. And laser the same, but I think it's a little bit better. Use laser, it's more safety, you know.
So which one do you think is safer? The laser?
I think it's laser, but you need to improve your technique and to get experience before using that, both.
Or is there any side effects with the procedure?
Yes.
Is there any side effects?
You can burn the skin, and you can make a lot of irregularities on the skin, on the surface of the skin. So that's why you have to be quite enough careful and used to use that both kind of techniques, you know.
If you have a complication during the procedure or post-procedure, how do you handle it?
Well, during the procedure, what happens? If something happens with anesthesia, I'm calming down, I'm letting my anesthesiologist to fix that, and that's it. If the patient is bleeding, because she's bleeding, I'm calming down, I'm making coagulation or whatever. I'm always calming down because I'm really good prepared to do my job. If I have any complication after surgery, well, that patient trusted me before, and because that, I'm taking care of her like she's my sister or my mom, you know, even. So if I have any complication, I'm there to take care of that. And we are plastic surgeons, so we know how to fix the stuff after our job.
There are many plastic surgeons nowadays. How do you advise people to choose the right ones?
Well, you know, there's good plastic surgeons, but so unknown. There's bad plastic surgeons with really, really good marketing, selling themselves like they are the best. But my advice is to the patient is to make sure he's a real plastic surgeon. I don't know in this country, but you can call to some place to make sure he's a real plastic surgeon, he or her, whatever, is a real plastic surgeon. And then you have to trust of him, to listen him, make them the right questions. And it's about a deal between each other. The plastic surgeon has to communicate and to transmit the patient the real expectations, and you have to make sure she's understanding everything, him understanding everything. You know what I mean?
But if you have like a stubborn patients and you advise her or him to avoid that kind of procedure, how do you handle that?
I'm just saying, it's easy, just saying no.
So it's just like easy. Black or white?
In fact, I'm just doing 30% of my surgeries, of my patients. I'm avoiding to do that 70%. Why? Because the patient wants something unreal. The patient has different big expectations, or there's not good communication between each other.
There are common mistakes we're facing nowadays. Can you tell me your opinion about that?
The most common mistake maybe is sometimes patients doesn't listen us. They want to make the surgery, you're explaining everything, and after that they're doing whatever they want. For example, if you recommend to rest after the surgery, there's even patients doing sports after 2 or 3 days. That's crazy, right? Of you telling them to quit off smoking before surgery because the scarring is worse in the smokers. They don't quit up from smoking, and they think they are cheating you. I'm not going to tell him I'm smoking, but the result is the bad scar. You know what I mean?
Of course, it's their health at the end. They have to take care of themselves. What is your favorite makeover, or what is your signature treatment in this?
Well, you know, I'm actually doing 70% of my surgery are breast surgery, breast lifts, breast mammoplasty, breast reduction. And one of the most difficult surgeries from my side, and I'm sure most of my colleagues are agreeing with me, it's breast lift with breast implants. For me, the most important is to focus the interview with the patient and to explain her what can happen about the scars, what's going on with the skin. It's not just about the technical, it's about how to focus the interview to make them understand what can happen after the surgery. Apart, it's a difficult surgery, to make them to know maybe there's a few resurgeries after that surgery, you know?
So thank you so much, Doctor, for being here and accepting our invitation.
I'm honored and
delighted.
delighted.
Hopefully we'll see you more often in Dubai.
I will love it. Thank you very much.